since the science on COVID-19 immunology isn't quite settled yet.
This is Theresa Tam. I'll answer this question. So yes, Health Canada authorized the sale of the first COVID-19 serologic test. So that's a test for your antibodies or your antibodies to the virus itself. So as you correctly pointed out, we don't know enough about the immunology of COVID-19. And these tests, in general, will test for antibodies that appear days or weeks after the infection. So they're good as a look at what the proportion of the population has been infected, for instance. So the approach that we're taking in Canada is to use these tests, first of all, in the context of population studies. So the immunity task force that was formed just a short while ago has been really active in trying to accelerate and prioritize these tests so that we can use them to determine across the population an estimation of how many Canadians are infected in different places or different age groups or in different risk populations, for instance. So that will be the first key use. And at the same time, together with research organizations and funders such as the Canadian Institute for Health Research, we have to study the immunology, the immune response to the virus at the same time. And then we can interpret these tests as to what they mean for an individual. So it is a little premature to be able to use these tests and interpret them on that basis. From a population level, these tests will be used in conjunction with the PCR tests to look at how they can be incorporated then into a wider testing strategy. But right now, under the collaboration of the Immunity Task Force, our priority is focusing on the population survey. Also to understand there are designs of these studies over time as well, to look across at least 2 years time span to see how the population changes in terms of their antibody response. That will give us even more information about how effective are these antibodies at protecting someone maybe against a second encounter of the virus, and how long does immunity last for. So I think it's a great news that the first test has been authorized. I also feel that we are benefiting from some of the information coming from other countries where they have had some experience with serologic testing. Some of the tests didn't perform very well. So we are sort of learning from that experience.